Hi, this is Kathy Hines. I am an IBCLC and I wanted to show you how to do a latch with and without a nipple shield. This is usually really important the first couple of days of breastfeeding. If you need a nipple shield, they're a great tool, but I would not choose to use one if it's not necessary. Reasons to use a nipple shield could be if your baby's not latching, after you've had good latch help and you've tried a few times, or it's painful when you breastfeed. Sometimes you need to have that little extra help to get baby positioned correctly. Or if there's a situation where you just do not feel comfortable breastfeeding bare, it is okay to use a nipple shield. Ideally, we're going to wean you off of them after the need is resolved. So if you do use a nipple shield, and this is one of the ones I like to use a lot, this is a cherry-shaped Mommy Vac nipple shield. It's hard to get in the United States, but I have a hookup. And this is a conical shape, and most of the time you're going to find a conical shape, but there are some cherry-shaped ones like the Lansdowne one that are available in the United States. Pretty easy. So one of the first things that happens with trying to latch your baby on the first time is there's a big concern that babies are not going to be able to breathe up against the breast. I can assure you that babies are designed to be right up against the breast. And babies will not stay latched if they cannot breathe against the breast. That's one of the reasons why I don't have people, one of the many reasons I tell people not to put their hand on the back of baby's head. They should be underneath on the neck to support their neck and allow their head to move freely, because you want them to be able to tip their head back to get a good latch, actually, but also to make sure that they are not smushed against, to the point where if they needed to move, say they had congestion, because that happens a lot after birth. There's, especially the second day of life, a lot of that gunk kind of comes down from the sinuses and gets in the way in the mouth and kind of looks bubbly and frothy. If that happens, sit your baby upright as much as you can. You can lean them against your chest, either facing you or facing away, and that helps them work it out a little bit, because otherwise it gets into their throat and or it stays in their sinuses and they can't breathe. Anyway, that's for another video. So I want to show you how to latch. Now, this is obviously not a baby really, but this shows you what the inside of the baby's mouth is going to be doing. So when you set up to breastfeed, ideally your breast is going to be a little bit tipped upward. If you see that, what I'm doing is it's kind of lined up with the upper lip. So you're going to be tickling that upper lip to get the baby to open up. And you want them positioned so they're nipple to nose, so their nose would be right about here. So nipple to nose, but you're going to tickle the upper lip. They should open up. And you're kind of, if you need kind of a spot to look at, to kind of aim for, you want that nipple to kind of be aiming towards the roof of their mouth so that when they go in, they will have as much of the areola as possible. This is a asymmetrical latch. Occasionally I do have to have babies on a symmetrical latch. It's not ideal, but babies who can't tip their head back sometimes after getting stuck, having birth trauma, any of those things, sometimes they are sitting in utero in your body and they're just get in a weird position and they run out of room in the final weeks of pregnancy, and so then sometimes this is what happens. You can get body work done from a chiropractor or craniosacral therapist. One of the things I like to do is I just like to put my hand under their neck and allow them to tip their head back just a little bit, as much as they are comfortable doing, and just kind of, it's called the guppy pose actually, if you've heard that, but it's kind of just letting their head kind of hang a little bit, as much as they're comfortable. If they fight you and they get upset, you've stretched it backwards too much. So you just wanted their head weight to kind of come down a little bit, and you can support the back of their head with your hand while you're doing that. I can do a whole video on just that with a doll if you like. So to try again, this is the latching technique, this asymmetrical latch. Hopefully you do that and they open up wide, and they go in. Now, where's their nose going to be? This is a small breast. It's not the best comparison, but say you have a breast like this and it's like, oh, it's bigger than the baby's head. That's totally normal. That's the way it's supposed to be. For some people, that doesn't mean size of breast really has to do with how much fatty tissue you have in your breast, which is helps protect all the glandular tissue. So it's not bad to have fat in your breast, but some people have highly compacted glandular tissue with very little fat in it, and they have plenty of milk. And this person could have it just put around, so the breasts are a little bit more less dense, a little bit more fatty tissue in there. All right, so if you see this particular nipple is puffy, we call puffy, and oftentimes, and I see it day 2 and beyond, you'll have some edema. Edema just simply means extra water in your cell, kind of basically your ankle swell during pregnancy. That's edema, but it'll end up around the bottom of the nipple, and then babies can't get this in. So if it's like this and it's just not enough of a nipple for them to kind of feel that and get it in their mouth enough, it's just too big to get in properly, you may have to do what we call reverse pressure softening. So that's when we take our fingers. There's a couple ways to do it, but this is my favorite way, is you kind of press, if you have short nails, press and kind of give it maybe a minute. Some people can do it really quickly. It just depends on how quickly your body is going to push that away. You can even do it for several minutes, but that'll help pop the nipple out, or not pop the nipple out, expose it basically, because it's just that extra fluid, and so you're pushing it back. You can also do it this way. There are things like a nipple shell or breast shell that can do this too, but generally those are really uncomfortable, and it's easier to use your hands. And adding another device to keep track of and clean is also kind of a pain. If you find that you have so much fluid you cannot get it away from the nipple, and the nipple shield is a good option for you, I'm going to show you how, number one, how to pick a nipple shield. So most people are going to be on the small end, so 16, 20 millimeter ones. Those are going to be the ones you want to go for. This is a 16. So on my larger puffy nipple, obviously this is not going to fit. But if you have a smaller nipple that looks kind of puffy, you may be able to put it on, get it on there. And when it gets on, or let me show you how to put it on, is you're going to take this nipple shield and you're going to put your thumbs a little bit in it. You're going to bend it halfway out. You can see where it's kind of doing that. And then you're going to flip it out, and then you're going to put it on top of the nipple and spread it out. I don't know if you could see that. Have it spread out like this. Now this is funny because it's not funny looking because it's not exactly the right size for this one. This particular person would probably need a slightly longer one, but a little bit shorter. But if you can see that, it's actually going to be, there's going to be some space here. We want that space. We do not want the nipple to reach the edge, because the little holes up here that get the milk out, they need to have a little bit of space to work. There will be milk that gets trapped in there. Sometimes we try to take the nipple shield off and get it poured into the baby's mouth, but it can be kind of complicated. It depends on where you are with your supply. But you'll see that this is a little big on the bottom, so if your nipple shield fits this way, it is a little too large. Let me show you with the cherry shape. I like this because it will grip a nipple a little lower down because it goes in slightly. So then, same thing, we're going to flip it outward, and then I'm going to angle the nipple into there. I lost my thing. and then it'll fit there. This one is a little on the short side. That's why I say you may have to go up for a like slightly bigger one. But you want it to look like this. And you do the same thing. So you have baby trying to latch on. You start from this. And then when baby opens wide, you bring it in and bring it in this way. The same, do the exact same motion. Remember, your baby can breathe against your breast, so please do not worry about their breathing, because they will not stay latched if they can't breathe. Remember that. And also, I've seen a lot of latches that are fabulous, but they get ruined by someone trying to make sure the baby can breathe. I specifically had it happen when I worked at a hospital where another health provider came in and said, oh, they can't breathe, and destroyed a perfectly beautiful latch by pressing down on the breast and pulling it away from the baby's nose. You do not have to do that. We don't, you want to be supporting the baby, and you want to be supporting the breast if necessary, or holding on to the nipple shield. Nipple shields are annoying, but we have them because sometimes you need them. But if someone suggests to you, oh, hey, let's do a nipple shield without an IBCLC seeing you, first thing is, if there's an IBCLC available, you should be seeing them as quickly as possible, especially if you're using a nipple shield, even if things are going great, because there can be some issues with nipple shields that come up. And if you follow advice online, you may get something that's really 30 years old. And I have unfortunately found that in very professional situations where colleagues, other people who work on, pediatricians, OBGYNs, nursing staff, whoever, that may not be up to date on their knowledge of nipple shields. It has changed over the years, even though the current guidelines are probably about 15 years old now. There are still a surprising number of people who will tell you certain things about nipple shields that's really out of date. So be aware of that, but remember, you want to put it on slightly inside out, that way it can grip the nipple. If you have to do it just because it keeps falling off, that's not wrong, but the first couple of feedings your baby is using it, when they're still figuring it out, you need to be able to give them the ability for the nipple to already be there for them. If you put it on and it's only sticking part way out, if they've done it a few times and they're adept at using the nipple shield, they can draw the nipple into the shield properly, but the first few times they will not be able to do that, so the nipple has to be kind of there. If your baby is wanting to have, they've already gotten some bottles and they now want the instant gratification of the bottles, number one, I would always make them wait like 10 seconds before you let the milk go in a bottle anyway. That's part of pace bottle feeding, because that'll help with that. But also you can massage your breast, kind of let it jiggle a little bit, kind of sniff your baby's head, hug them. A lot of times the baby's cry will starts your letdown, which is the milk ejection reflex. The glandular tissue will start to squeeze down on it and push the milk out of the breast. If you see a drop coming out on its own, that's the letdown. So you may have to do that the first couple times if the baby is kind of just doesn't want, is like, I need that instant gratification, or they're really sleepy. So hopefully that gives you some information on these tools and how to latch a baby, and please reach out if you need any help. Bye.